Please be sure to select who you'd like to send your chat to the host or everyone. But now we'll move on to the presentation, applying behavioral psychology to Stop AIS. And today I'm pleased to introduce to you Ken Donnelly. And for more than 25 years, Ken has been developing behavior change programs on a wide range of sustainability issues for the past 10 years. He is focused on invasive species, and based in Halifax, Nova Scotia, he works with clients worldwide. And Ken also publishes a weekly email newsletter on behavior change news and techniques. And with that, I'll pass the presentation on over to Ken.
Thank you, Jesse. And thanks everyone who is on the call. Just one second, I'm just switching to my presentation. And all right, so everyone can see the slide?
Yes.
Yeah, okay. Well, thanks to the New York Sea Grant for setting this up, and Jesse and Sam for our work in preparing for this. I'm really excited to be talking to the audience here about behavioral psychology and using it to stop aquatic invasive species. As Jesse mentioned, I have been working in behavior change programs for about 27 years, I guess now. And I've been applying it particularly to invasive species for the last 9 or 10 years in Canada and in the United States. And I've also been conducting seminars and workshops in Canada, the US, and the UK, and even the Caribbean since 2000. And when I start my workshops, I generally start them the same way. And I ask people, it's a bit of a icebreaker, and I say to people, look, put up your hand if you think blood donation is a good idea. And generally speaking, people do believe that blood donation is a good idea, so everybody's got their hand up. And then I say, well, look, why do you think blood donation is a good idea? And I just point to people in the audience, kind of put them on the spot. And everybody knows the reasons why. So people will just say, well, because it could save a life, it could save your own life, it's a renewable resource, it makes you feel good when you do it, you feel like you're giving back to the community. So people can readily explain why they think blood donation is a good idea. So from that, as I say, I've been doing this since 2000, and from that, I say that 100% of people believe that blood donation is a good idea, and 100% of people know why blood donation is a good idea. So everyone has the right attitude and the right level of awareness on blood donation. But the fact is that in the United States, only 3.5% of people give blood. And the same thing in Canada, it's about 3.5%. In the UK, it's approximately 3.5%. It's about 4% in Trinidad. And those are some of the places that I've looked it up when I've been giving workshops. So we have a real gap there between the attitude and the awareness and actually conducting the behavior. Now, to be fair, only 38% of Americans qualify to give blood. In Canada, 50% of the population are qualified to give blood. But you've only got 3.5 out of 50 that are doing it in Canada, 3.5 out of 38 that are doing it. So there's a real gap there. And you can see that the awareness and the attitude about blood donation is not transferring to actually doing the behavior. I'll give you another example, and this is a bit of an icky one. Doctors washing hands. Now, doctors, nurses, medical practitioners, they go to school forever. And they know all about communicable diseases, and they know why they should be washing their hands between going from one patient to another. So I think it's fair to say that 100% of medical practitioners have the right attitude that they should be taking preventative measures to make sure that they don't take something that's a communicable disease, take it from one patient and go and possibly transmit it to another patient. They know all the reasons why. They know better than any of us on why that's important to do so. Yet, in a study of an observational study in several medical facilities on Vancouver Island in Canada, only 12% of doctors were compliant with hand washing protocols. Doctors, nurses, and other medical practitioners, only 12% were compliant with the protocols. And this isn't something that is just limited to that particular area. There's problems with this in the United Kingdom and in the USA, across Canada. Where I live, there's a hospital where it's got to be about 6 or 7 years ago now, I think, but several people in the hospital, several patients died. And after the investigation, it was determined because the hand washing protocols were not being followed well enough. Again, all the attitude and the awareness that you can imagine does not translate into the behavior. And you can Google, like this is a headline from NBCnews.com about the US. You can do a Google search on doctors washing their hands and probably find that in your state or province or wherever you're from, that there's indications that there's a lot of work to be done on getting medical professionals to wash their hands. So the thing is that hopefully these examples explain that just having the right attitude and the right awareness doesn't necessarily translate into someone performing the associated behavior that you would expect. So when we do communications, traditional communications work, like putting ads on TV or in newspapers or on billboards or whatever it is, and create awareness and try and create attitude and measure the number of times people have seen the message and all of that. That's not, you cannot make an assumption, and you ought not to make an assumption that because you've done a great job on ensuring everyone is aware about an issue and has the right attitude about it, then your work is done because the behavior will follow, because it's not true. And in fact, this is such a real issue, the psychologists have a name for it. It's called the attitude behavior gap. So, the most important thing from this webinar today, if you don't remember anything else a month from now, please remember that you cannot just convince people that something is a good idea and then expect that the behavior will follow. It just doesn't work. Some people will do it, but you cannot expect that a majority of people are going to do it just because they think it's a good idea. And if you look at, just going back to the blood donation one for an example, I know in Canada, where I'm from, we have these wonderful ads on television, and they just grab your heart, and they show children in hospitals and things like that, to images that compel you to give blood. And they're very slick production, really well done ads. The thing though is that a purpose of an ad like that is to add awareness and to add attitude, to add to awareness and add to attitude. But from my non-scientific polling over the last 19, 20 years, there's no room for improvement in attitude and no room for improvement in awareness. What they ought to be doing is working on the actual behavior, because behavior is not following. So now I want to say that having the right attitude and awareness is still important. So you still have to make sure that people have the right attitude and awareness. You can imagine standing in front of a blood donation clinic and stopping people on the street, and they don't know about the benefits of blood donation and aren't aware of it. And you just say, hey, listen, would you come into this building with me? We're going to put you on a gurney and we're going to suck a pint of blood out of your body. Nobody's going to do that. So you have to have the right attitude and awareness, but you can't just assume that the behavior will follow. So how do we apply this to aquatic invasive species? Well, we can apply it actually to anything that is behavior related, human behavior related. But the example program I'll use today, I'll use examples from a clean, drain, and dry program. because we are talking aquatic invasive species, and this will just give us some focus. However, as I say, if you're also working on Play Clean Go programs, you can apply this to getting people to get the mud and plant bits off their boots and clothes. You can use it to get people to check for ticks if you want. You can use it in health, but we'll talk about clean, drain, and dry as an example today. So when we apply behavior change programs, and some of you may be aware of this through community-based social marketing, which is this toolkit that has been used, and it was developed by Dr. Doug Mackenzie Moore back in the early 90s. This will be similar or familiar to you. So I'm going to walk through these behavior change steps in the time that we have together here, and I'm going to do so fairly quickly. The very first one is to do research. It's really important to do research, and the reason that we research is to identify and remove barriers. We want to find out what's preventing people from adopting the behavior that we want them to do. Like, why are people who think that blood donation is really important not giving blood? We want to find out what those barriers are, and we want to try and remove them. But also at the outset of a program, we can establish a baseline by asking people if they're performing these behaviors, or watch to see if they're doing it, because then we can measure against the performance of the behavior change program that we put in place, and we can check at the end of it and see if we've made progress. So with the research methods that we use, now I'm not going to go into a lot of detail here because it would take up all the time we have, but we generally use literature reviews, we do surveys, we do focus groups where necessary, if we want to drill down and find out more information. We'll do observation, watch what people are doing, rather than, when you ask somebody if they clean, drain, and dry their boat in a survey, there will be a bit of social bias, and some people that don't do it will say yes because they know it's the right thing to do, and they want to please the person asking the question. If you do observation and you sit at a landing and count the number of people that come out and record how many are actually clean, draining, and drying their boats, then you have better numbers, of course. So those are the different things that you can do. Now, I do warn people that those research methods are expensive, and not everybody can do all of those things, or even some of them. You do what research you can with the budget available. The worst thing that could happen, in my view, at this stage in one of these programs, is somebody saying, oh, I don't have the money to do this research, so we're not going to do anything. You do what you can with the budget available. I've worked with nonprofits that have absolutely no money, and I've worked with governments that have the money to do all of those elements, but you do what you can with the budget available. And the reason you do research is you need to know, the primary reason is to know what the barrier and benefits are. We ask people in our surveys, and we just did a survey in Canada of almost 2,000 people last year. We asked people why, if they clean, drain, and dry their boats. And if they say yes, then we say, okay, why do you do that? Because we want to know what the motivators are. We want to know what it is that has motivated them to take the action of clean, draining, and drying their boats, an action that we want everybody to be doing. Because then if we know that motivator or perceived benefit, then we can use that to encourage other people to do it for the same reason. We know that's a motivator that works, so we can use it in our strategy. But we also want to know what the barriers are. So if they answer no, that I don't clean, drain, and dry my boat, then we say, well, why not? And the information that we get is really important. In that study that I mentioned, the three main reasons why people said that they did not clean, drain, and dry their boats was, first of all, they said the equipment was generally not available for them to do it. Secondly, they said there wasn't enough space provided at the landing that they could pull off and do that sort of thing. And thirdly was a time issue. They said, it's a busy landing that I go to, and you're in a hurry, so you're not holding people up, and you need to get out of the water and get out of that area to make room for other people. So those were the three things. And then what you want to do when you have those barriers is you want to try and remove them. And the most important part of trying to get people to adopt behaviors is to remove barriers. I look at barriers as like friction, as outside forces working against a person performing the behavior that you want them to perform. So, and if you can imagine pushing a fridge up a ramp, say to move it into an apartment or a home or something, and if you're pushing uphill, that represents the forces that are pushing back against people performing behavior. So if there's no equipment available and they feel that they can't wash their boats, then that's like a force that's pushing back on them, and it causes friction and makes it more difficult to perform the behavior. So if you can remove those barriers, then you sort of flatten out the ground or that ramp, and things are easier because you've removed it and they can push it much easier. Or if you put wheels underneath it, right? You're removing some of those external forces that are preventing people from adopting the behavior. Now, I'm going to talk a little bit later about social norms and peer pressure, and if you can accomplish getting people around you to do, or around the subjects to do the right thing, they'll have peer pressure and they'll feel compelled to do it because other people are doing it. It's perceived as the right thing to do, and then you actually have forces that are helping to push that fridge downhill. They're on your side. They're pushing from the same side as you are. So barrier removal, according to Daniel Kahneman, who's a Nobel Prize-winning behavioral psychologist, is the most important part of performing behaviors, or getting people to perform behaviors, is to remove those barriers. So, and essentially that can be seen as making it easy, making it convenient. So we've got a picture here from one of the programs we've worked on, and there's a portable boat washing station there. The fellow that is on the left with the pressure washer is showing the people in the boat how to clean, drain, dry their boat, where to look for invasive species and that sort of thing. The equipment is there, it's available, it's in a spot that's that isn't blocking traffic. So they've removed two of the barriers right there. And he's also doing this, he's explaining them how they can do it the next time, but he's also saying, it doesn't take long at all. So that helps to remove that barrier of concern about the amount of time that it takes. So make it easy and make it convenient. That's one of the most important thing about barriers, is trying to remove them and reduce the friction. So next thing I want to talk about is promoting the behaviors. I mean, if you want people to adopt the behavior, you find out what the barriers are, you remove them, you find out what the motivators are, and you try and promote them. A quick thing on motivators, in that survey, we asked people, as I said, what motivates you to clean, drain, and dry your boat? And in many cases, people said, well, I don't do it. I do it, but I don't do it for invasive species. I do it because I want a nice clean boat, and I don't want there to be mold, and I don't want it to smell, and it's just good maintenance for your boat. Well, you don't necessarily have to convince everybody that the reason they're going to do this is to stop invasive species. It can be a side benefit, an extra benefit in their minds. So you can say, the same things that help stop invasive species, the cleaning and draining and drying of your boat, are very important for boat maintenance. Your boat will last longer, it'll look better, and it's just good maintenance practices. Plus, you're going to help protect the waterways that you're in. So, but then you need to promote the behaviors, and just very quickly, very clearly, this is a sticker that was used in the first year of the British Columbia behavior change program that I worked on for aquatic invasive species. We had these stickers that we gave them out to people, and it just shows you exactly what it is that they should be doing. If it's something else like Play Clean Go programs, you know, you want to tell people that they should clean their boots, and you know, this picture shows that you should use a brush to get rid of that mud or whatever. You want to tell people exactly what those behaviors are, so they're doing the proper behavior. But you know, I think that's common sense. But when you're doing behavior research, or sorry, behavior change programs, you better be very explicit about what that behavior is, because if it's misconstrued, people may very well be doing the wrong behavior with great intentions. So after you promote your behaviors, you want to secure commitments. Now, commitments are a promise to perform the behavior. And from a behavioral psychology perspective, commitments are very strong. And that's because in our culture, people want to be seen to be consistent with what they say. If you say you're going to do something and you don't do it, then that's frowned upon in our society. People will look badly upon you if you haven't done what you said you would do. So that's an important factor. But there's also another factor, is that when people make a commitment to do something, they change their own self-perception. So if I make a commitment that I'm the type of person who prevents spread of, if I make a commitment to prevent the spread of AIS, I will subconsciously change my own self-perception, and I will see myself as someone who takes the proper steps to stop the spread of aquatic invasive species, or invasive species in general. And if I say I will clean, drain, and dry my boat, I'm going to change my self-perception to be a person that cleans, drains, and dries their boat. And even, I'll talk more about peer pressure later on, but there's an internal pressure there that you've made a commitment that you're going to do this. You'll feel badly when you don't do it yourself. You'll feel badly yourself when you don't do it, because you've made that commitment. So this is a really strong factor in getting people to develop or to perform the behaviors you want. So it's, first, you're removing those barriers, and secondly, you're getting them to make a commitment to do it. And I'm going to spend a little bit of time talking about this. Now, that picture, those two fellows, the guy in the blue and red, or maybe purple and red sweater, and the fellow that's filling out the form, are the same two gentlemen that were on the boat that was being pressure washed. And I don't know about you, but I look at those two guys and I wouldn't have jumped to the conclusion that they're people who are going to make a commitment to clean, drain, and dry their boat. But that's exactly what that fellow is doing. So when we work on these programs, knowing about the barriers that prevent people from performing the behaviors that we want, because we've done our research, I generally will write scripts up for the people who are in the field. I call these interventions, doing interventions and gathering commitments. And what the way the script will work is, I put in a table on the left-hand side, and in one column, I'll put a barrier, and a barrier would be equipment not available. And then I'll have some patter in the next table, in the next column on the same row, that essentially says, well, if this person says there's no equipment available, then this is what you say. You know, well, if there's no equipment available, you might be able to pressure wash at home, or even using your garden hose with the pressure setting on the handle would be a good alternative. You know, it's not that hard to do. Can you do it? And then the next barrier in that table would be, well, there's no room to do it here. And you can say, well, the pattern might be something what says, yeah, I know I've run into that myself. Sometimes there isn't enough room, but when that's the case, you know, I just go home and do it where there's, in my driveway where there is room. Can you do it there? Or I might stop at at a car wash and do it there. Is that, like, can you do that? So when people present the barriers, we remove them that way in our discussion with them. But each time we remove a barrier, at the end of it, we say, so can we count on you clean, draining, and drying your boat then? Or will you will you clean, drain, dry your boat? And if the person says no, throws up another barrier, then we use the pattern for that particular barrier. And eventually you can look at it as kind of wearing them down. There's no more barriers for them to throw up in your face. And eventually when you say, can we count on you doing it again? Do it, please. Sorry, can we count on you doing it? Then they'll say yes. And when they've said yes, they make a commitment. They've made a commitment to you, and it has all of those benefits as I described, of self-perception and that sort of thing. So the way we work it, and I call this climbing the ladder of commitment, is we generally have a clipboard like that guy has there, and we hand the clipboard to him, and on the clipboard is a form that looks like a petition, and we say, that's great. We're keeping a list of all of the people who've made a commitment to perform this behavior, to clean, drain, and dry their boats. And can you just add your name to the list? Well, the person's just said they'll do it. Well, you know, not everybody will put their name on it, but most people will. And the benefit of that is that we know from research and from behavioral psychology that written commitments are much stronger than verbal commitments. So that a person who has made a written commitment is much more likely to actually do it than a person who's made a verbal commitment. So that's why I call it climbing the ladder of commitments. And while that fellow there is putting his name on and adding it to the list, and he doesn't know he's making a stronger commitment, but he's just putting his name on, the gentleman there in the hat with his left shoulder to you, he is saying, this is great, thanks so much. And by the way, if you just click the little box beside your name, or not click it, if you check the box beside your name, then you're allowing us to use your name or your initials or first name and last initial, however you want to describe it. And we're going, because we want to use that publicly, and we've got a list on a website, or we publish a newsletter, and we want to show people that there are a lot of people just like them who are clean, draining, and drying their boats, because if there's a lot of people doing it, then more people will participate. And not everybody will click that, or click it. Not everybody will check that box, but many people will. And when they do, they've made a public commitment. And public commitments are stronger still than written commitments, which are stronger than verbal commitments. So that's an approach that we use on all of our programs. Commitments are so strong that I say that when I'm working on a project, anybody that gets within 10 feet of me is going to be asked for a commitment, even if it's on the phone, if I'm on a hotline or something like that, and somebody's called in to get more information. Before I'm finished, I'm going to say, well, can I count on you cleaning and draining and drying your boat? And when they say yes, I know that I'm much more likely to have a new behavior adoptee than I would if I hadn't asked for the commitment. So everybody gets asked for a commitment. Maybe one quick comment on commitments, just because we've got that picture of what happens in the field. One of the things that we've found in our programs is, and some of our clients say to us, that they're having difficulty obtaining commitments. And what we've found is that in many cases, it has to do with the person that is out in the field, the intervener. Some people don't want to ask for the commitment. They don't. I don't know if it's a concern about rejection, a fear of rejection, or whatever. But they're just not so comfortable to say, "Okay, well, will you do it then?" They'll talk all about how important it is and make sure that people have the right attitude and awareness, but some people just don't want to say, well, can I count on you doing it then? Or will you clean, drain, and dry your boat? And so if you're working on a program and you're going to be doing interventions like this and field work, one of the things that you should ensure is that the people that are on the front lines and are talking to people are quite comfortable in doing that. Now, we've done role-playing exercises when we've been training people, and that helps a bit. But if you have the wrong person, whether they're shy or whatever it is, for some reason they just can't ask that question, then you've got the wrong person in there. All right. Next, after commitments, is reminders. Reminders are pretty simple. They help support the commitments. So I'm sure you've used reminders in the work that you've done. Some typical ones in an office setting are the last one out, turn off the coffee pot, or last one out, turn off the lights. They're very simple and effective, but they have to be in the right place at the right time, and they have to have the right information. For instance, if I was in an office, I've got a client in Halifax here, and they have a really nice boardroom, and the boardroom actually has a balcony off it. And so sometimes I guess people had gone out onto the balcony and then come out and failed to close the door to the balcony, which is behind a curtain, by the way, and left it open and left the boardroom. So they wanted to make sure that people closed the door to the balcony, made sure that the balcony door was closed if they were leaving. So they put a sign up. Now the balcony is on the opposite side of the room from the exit entrance door. So they put a sign up beside the door to the balcony. The proper place to put the sign was the door to exit the room, because if you're coming off the balcony and you step back into the boardroom, that sign is behind you. You're not going to see it. It will not remind you if you then head out of that boardroom, out the door on the other side of the room. That reminder is just not in your vision. So the proper place to put a reminder like that is at the exit door, saying, please make sure the balcony door is closed. But a prompt in the wrong place or a reminder in the wrong place is not effective. Same thing with the last one, turn off the coffee pots, the last one, turn off the lights. It's really important to have that in the right place. I've seen, in fact, I worked in an office where way back in the kitchen, there was a little sign by the coffee pot that said, last one out of the office, please turn off the coffee pot. Well, if you're heading out and you have to catch your bus or whatever it might be, you're hurrying out, you're not going to run back to the kitchen and read that sign. You're going to be heading out the door, and if the sign is right there at the door, last one out, turn off the coffee pot, and you say, oh, I'm the last person, I better go back and check the coffee pot. That's a reminder in the right place at the right time, telling you the right thing to do. So it's really important. And as an example, I was in a meeting a little while ago, and we were talking about reminders for clean, drain, and dry, a different program, and it wasn't in the US. And somebody said, kitchen magnets. I love kitchen magnets. We should do kitchen magnets. Sorry, fridge magnets. That's like the worst place to try and remind somebody to clean, drain, and dry their boat is in their kitchen. You want to have that reminder on the boat or on the trailer or at the landing, not in your kitchen. So and believe me, before I learned about behavioral psychology, I had a lot of fridge magnets made up because I thought it was a good idea, but I realize now that they weren't. Fridge magnets work really well for behaviors that you want to do in the kitchen, like get people to do like recycling. So here's an effective prompt. That's one from British Columbia, again, for their Clean, Drain, and Dry program. It's at a landing. It's clear and simple. It's right where the decision is to be made on clean, draining, and drying. It provides the information. You can see the information from the sticker that I showed before on how to clean, drain, and dry. And it has that graphic that is often used in AIS programs for Watercraft that shows a boat and trailer and where to look. So it's a reminder that supports that other elements. People that have made the commitment to clean, drain, and dry their boat, they may not remember all the details about how to do it well or where to look. It provides that reminder of the information as well. You can do the same thing with brushing your boots or other programs as well. You can. It's not just relegated to aquatic invasive species and cleaning and draining and drying your boats. Yeah. So the last thing I want to talk about today in the time that we have is developing a culture or developing a social norm. Now, social norms are very powerful. They're based on peer pressure mostly, and they're a very important part of applying behavioral psychology to get people to adopt new behaviors. And I like to use this example that in North America, when people get into an elevator, they walk in, they turn around, and they face the front of the elevator. They face the door, and everybody looks at the door, or they look down at their shoes, or they look up at the lights changing as the elevator moves through the floors, different levels, but they don't look at other people. And that is a social norm in elevators in North America, and it's a very powerful one. If you were to walk into that elevator and put your back to the door and face back at those 5 people, they would be very uncomfortable, and they'd be anxious to get the hell out of there because they'd be wondering what's wrong with this person that has come in here, even though you're really not doing anything terrible, but you're breaking a social norm. And when you break social norms, that makes people uncomfortable. So social norms are very powerful. Another example I like to use is this one about coughing. When I was a child, I learned how to cough into my fist. My mom would say, I'd cough, and my mom would say, cover your mouth, cover your mouth. And the proper way to do it was to cough into your fist. Well, from a practical perspective, coughing into your fist is not a good way to prevent the spread of disease. Because there's a good chance that you may touch a person or touch something that somebody else is going to touch. So it's a good way of transmitting disease rather than preventing it. And so I don't know how long ago, but maybe around 10 years ago, we all started to learn to cough into our elbows rather than into our fists because there's less chance of spreading the disease. Now, today, if you were to cough and cough into your fist, that was the proper behavior, and people would have thought, way to go, you're trying to protect this, you're coughing in your fist. Years ago, people would have thought, good on you to be doing that. Now they'd be saying, you idiot, what are you doing, coughing in your fist? Like, I better stay away from that person. They're not coughing into their elbow. So that's how powerful social norms can be. Here's a picture of that sign at a BC landing again, and when you have a sign like that, it is an important behavior supporter, but it is commitment supporter rather, and a reminder, but it also helps establish a social norm because it's hard for people to come out of the water with a boat, go right past that sign and not clean, drain, and dry, especially if there's other people there because of the peer pressure. So sometimes these components, like reminders, can also be help support the social norm. And just one final example here of social norms. And this one may resonate better for the men in the audience than the women in the audience, but there is certain etiquette when you go into a washroom and you're faced with the choice of 3 urinals. So if you're the first person to go into that washroom and you're choosing a urinal, despite there being 3 urinals there, men will know that there are only really 2 choices. We can call those urinals 1, 2, and 3. It's okay to choose urinal number 1, and it's okay to choose urinal number 3, but the social norm is when you're the first person in, you would never choose urinal number 2, because if you choose number 1, then the second person that comes in can use number 3 and then maintain the all-important urinal buffer. But if you choose number 3, same thing, the other person can come in and use urinal 1 and the buffer is maintained. But if you go in and you're the first person and you choose urinal number 2, the next person has to be uncomfortably close by being in 1 or 3. So that is covered, I guess, by the universal urinal etiquette sign, which is really weird because of those arms. I don't know what those men are doing with their arms outstretched, but at least they're not breaking the social norm. So this is my last slide here, and I just want to make the point that when we're working on behavior change, all of these elements I've talked about, getting commitments and having reminders and removing barriers, what we're trying to do is drive the behaviors into the subconscious rather than conscious. When we do conscious things, it takes a lot of energy and it takes a lot of brain power. I'm sure everybody in this audience has at some time driven to work, got there and thought, oh my God, I don't even remember the driving. You know, I got here and I don't really recall, I wasn't paying attention. Well, the fact is that if you're always driving to work and you're taking the same path and you know where the lights are and you know where to turn, you can do so subconsciously, even though driving is a very complicated thing to do. You know, you have to watch out for other traffic, you have to watch for lights changing, watch for pedestrians, but when you do it over and over, you can do it subconsciously. And when we can drive these behaviors into people's subconscious, then it's something that they will do by rote rather than having to concentrate on them all the time. And that is a very powerful psychological, or very powerful application of behavioral psychology to foster this behavior change. So that's my information, my contact information. I want to thank everyone for listening. I want to thank the organizers at the New York Sea Grant for putting this on. I'm very happy to be part of this important webinar series. I'm looking forward to the other webinars. And I've set something up that if you are interested in getting the slides for this presentation, you can take out your phone, just do what it says there, text beyond 18 to 44222, and those slides will be sent automatically to you. You will also be subscribed to my Behavior Change Friday email blast, which gives tips on behavior change. I send that out every Friday. It's designed to be a 5-minute read. And if you don't care for it, you can unsubscribe anytime. There's always a link in it to unsubscribe. So thanks again. And Jesse, I'll be happy to answer any questions.
Okay. Yeah, thanks to Ken and also for everyone again for joining us. My apologies that we missed a little bit of the housekeeping at the front end of this, but that was basically all about technology anyway, so we should be back on the right track. So now we're going to start the question and answer session. You can, again, still submit questions into the chat box. Feel free to do that as we go. I can also unmute folks if they want to ask the question out loud as well. Just send something in the chat box and I can do that. So I'm going to go through a few questions now. A couple things that are popping up. Will this be on YouTube? I believe it's going to be available on the Sea Grant website. Sam, I can unmute you as well just to double check on that. Okay, Sam, you're on as well. Will that be available through? Oh, there you go. It's the website is on there right now. So I don't see any questions at the moment in addition to those, but I do have some written down that I wouldn't mind asking. And one of them was kind of about the messaging that you've got with some of these commitments that you're getting from folks. I've found that in different situations, I might have multiple different messages. Some may be maybe situation specific or community specific. When you have that kind of a complex message, is there still good ways to get commitments from those folks? Let's see, I mean, I guess I want to feel confident in what I'm telling them, and I want to feel confident that what they're committing to do is the right thing to do. And if there's some gray area there, Ken, what do you think about ways to address that?
Well, one thing is that like that sticker that I showed that had the changes to, the description of the procedures with clean, drain, and dry. Because clean, drain, and dry you know, is more complicated than, say, you know, don't smoke indoors or whatever. We would have a package of information that we would be giving to everyone when we're doing these face-to-face interventions. And, you know, maybe the face-to-face intervention isn't necessarily outdoors at a landing. We might be doing it at a boat show or whatever. But we would be, especially when it's complicated like that, we would be providing information to them to make sure that that complicated behavior is understood. And in the case of clean, drain, dry, like that sticker that I showed you, we may suggest to them, for instance, would you, if they were there, I would ask for permission to place it right on the stand where the winch is for them to roll up their motorized watercraft onto the trailer, because that would be a really good place for a reminder, because they're standing there and they're cranking that winch. And then it also provides the information. If they were at a boat show or someplace else like that, I'd hand it to them and say, and suggest to them that they place it in that spot. But the key thing is to make sure that they are getting the right information and they have it, because when they go to do it, like I said before, it's not very good if you've convinced them to do the wrong behavior or do the behavior incorrectly.
Okay, thanks. We've got another question. So in the context of starting a new program, let's say you're going to start a clean, drain, and dry program, what would be the first steps to start that program, you know, after research and baseline has kind of been established, keeping in mind that there's budget limitations. So what are kind of the priority activities? Where do you start with something like that?
Okay, well, just on the research side, there's a lot of, or there's often, I should say, a lot of information available through a literature review. If you do a literature review, and you know, literature reviews are a lot easier now than they used to be when I first started doing them 25 years ago because of Google. You can find information on many different behaviors that have already been done. And while it's the best to be able to do a survey in your own area, if you simply don't have the money, then the best thing you can do is try and find out what people have said in other areas where surveys have been conducted. And you may have to make an assumption that those are the same barriers that that exist for the people, the population, the target audience in your area. So it's you want to make sure that you're doing the best you can with the money available in order to find out what those barriers are. And then the next step after that is to remove those barriers. It's so important. I sometimes use the example that at a conference, if you see a bowl of fruit with bananas, apples, and oranges in it, the bananas will disappear first, because bananas are a lot more convenient to eat when you're at a conference and you're going to take it over. You grab a cup of coffee, you grab a piece of fruit. The banana, you can take it over and you can put that banana peel down beside you at your table for the time you're there without too much of a mess. An apple, the apples go next. You can put the apple core near you on a napkin, but it looks grosser than the banana peel does, so they go next. Oranges are a pain in the butt because you get orange juice on your hands, and you've got a whole bunch of little pieces, so they go last. The thing is that because bananas are easier than the apples, which are easier than the oranges, they disappear in that order. And so removing those barriers and just making things easy is the most important step. The last thing I'll say about that is, you know, I was in Newfoundland, and about 15 years ago, I did a workshop, the 2-day workshop. And at the end, the organizer said, and there was probably about 30 people in the workshop, and the organizer said, you know, all of this stuff you've talked about research, we're all NGOs and we have no money. Like, we have no money at all. Does this mean we can't do this stuff? And I said, no, absolutely not. Get on the computer, do a lit review, find out the best information you can, and then start getting it in place.
That actually brings up a good point. Just maybe to piggyback on that is that, you know, I find that people really want to go out and do something, physically do, you know, something. And a challenge that I sometimes face is that I think a lot of people maybe think they already have a good handle on the motivators and the barriers for certain activities. And that baseline research and information, I think, is pretty important. And sometimes that might get overlooked or maybe not funded because there's more actions that are going on that seem to be a little more attractive for funding agencies.
Mm-hmm.
Any advice on overcoming kind of establishing baselines and getting a better handle on what really what stakeholders are thinking?
Yeah, well, certainly there's it's called social bias. When you do surveys and you ask people if they're doing the right thing, they'll over-report. And if you do a survey at the end of a project and you ask them again, there'll be over-reporting again. However, if the over-reporting is higher in the after than it was before, if the numbers are higher than before, you've made progress. It's just not accurate. So if 60% of people say to you that they're cleaning and drying their boat when only 40% are, you've got over-reporting. But at the end of the project, if you've got 80% doing it, or 80% saying they are, and 60% are, you don't have an accurate reflection, but you've made some progress. But observation is really the best way of doing it. Now, it doesn't work in all cases, but in many cases, you can use cameras. You have to be careful of where you do that and not be invading people's privacy. But we've had people sit out at landings and in other places and record behavior. But a more efficient way of doing it is to put a camera up and record for 8 hours, and then someone can scrub through that recording quickly and speed by the times when there's nobody there and just record the number of people who perform the behavior and make comments on how well they did it, and record the number of people that haven't done it and get a good observation study without spending 8 hours sitting out in the sun watching.
Okay. We've got another question. If you were aware of the community-based social marketing commitment programs that target limiting anglers' use of live bait fish.
Yeah, we're working with Minnesota right now, and we're trying to address that. And I know in New York, I've been talking with Kathy McGlynn too about that as well. And community-based social marketing is behavior change. Most of what I've talked about here is based on Doug McKenzie Moore's community-based social marketing model. Doug's a friend of mine. I've worked with him in the past. But I talk about behavior change because there's other elements of behavioral psychology that should be employed as well. But as far as fishing gear goes, there's not as much information available. If you do a lit review on anglers, there's not as much, but there is. We've done some studies for the Ontario Federation of Anglers and Hunters. They have a lot of work. That's a great organization. They have a lot of information, rather. It's important to recognize that, and this is something I've been harping a little bit about lately, because I've realized this in the research that I've done. All marketers have a tendency to really segment audiences. And I think we have to be very careful about that with aquatic invasive species and other invasive species programs. But a lot of anglers are also watercraft users. And if we treat them separately, and we only talk to watercraft users when they're out there using their watercraft, and we don't discuss the proper bait procedures and cleaning gear and that sort of thing, then we're missing an opportunity. We only talk to them about their boat, but we haven't talked to them about their fishing gear or their bait. And same thing when we're talking to people fishing. If we're at a place, you know, on a dock, say, or a wharf, as they call them here, and we're talking to people at a fishing derby. Well, we want to be talking about cleaning your watercraft and cleaning your fishing gear. So it's really important that we don't get too far down that path of target segmentation that marketers often do, and recognize that, you know, people that are outdoors, they, you know, people who are out in watercraft and are out in fishing, they may also be campers, they may be hikers, they may be moving firewood, and we should be taking the opportunity to convince them that they should be taking all steps to stop the spread of invasive species, and not just the ones like proper disposal of bait, just as an example.
Okay, I'll throw out one last one, and then maybe we'll wrap up. If there are other questions, there's going to be a survey provided so that they can go there, and I'll also keep track of these and see what other folks want to do to address some additional questions for wrap up. But one last one. Someone asked about convincing governments, communication departments, that behavioral change is really necessary and important versus some of maybe what would be considered more traditional approaches, where the focus is on repetition and messaging, maybe a little bit more cheaper, shorter term things, perhaps, maybe versus long-term time commitments. Yeah, feel free, go ahead.
Well, that's a fantastic question. It's something that comes up all the time. I sometimes get calls from people and they say, I'm really having a tough time with my communications department because I took Doug Mackenzie Moore's community-based social marketing seminar, and I understand this behavioral psychology stuff, but all the communications people want to do is put out ads and measure repetition and impressions. And clearly, if you measure that 100,000 people drove past a billboard in the last month that said you should clean, drain, and dry your boat, that is not at all a measure of how many people cleaned and drained and dry their boat. But the whole marketing industry is based on measuring repetition and impressions rather than actual achievement in things like that. So what I often suggest is to people as we're embarking on a program like this is to engage the communications people at the outset. It's so important because they often will have a veto, and you may get to the end. And this actually happened to me in a major project in Canada, that where we actually had a large steering committee from a whole bunch of different government agencies and NGOs involved in a very important program. And when we got to the end, it was an expensive proposition. If I remember, I think the budget was around $80,000, and this is like 10 years ago. And we got to the end, and when the communications people read it, they just submarined it. They said, this is crazy, we're not doing any of this. And the whole program, which was based on rigorous study and research, was just sunk by two people in the communications department that said, no, we're not doing this. And so, and you know, in fairness to them, they just don't have the training. You go to PR school, whatever it is, and I don't mean to say anything bad about public relations professionals. They're acting on what they know. They've gone to school, they've learned this stuff. They generally don't get behavioral psychology training. And when you come to them with a finished product from a research project and they don't understand it, they're not aware of any of that, you can see why they might reject it. So it's best to engage them at the beginning.
Excellent. Well, thank you again, Ken, and thanks to everyone for attending today's webinar. Your insights are definitely helpful for us to shape future events, so please fill out the evaluation form that we have. You can click on the link that's now posted in the chat box from Sam to everyone. And on behalf of today's presenter, and certainly New York Sea Grant, thanks for joining us, and we hope you found this information and dialogue valuable in supporting your work. Please tune in to our future webinars. Our next one is on January 24th. That will be covering the Steward Program, New York Watercraft Inspection Steward Program application 2018 data overview. That's methods, statistics, and analysis. And please enjoy the rest of your day and join us next week. Thanks, everyone.